thank you everyone for being here. We're very excited to present caregiving during a pandemic, especially dementia care practices. And we're here with Sunrise East 56, which is very exciting, a new community in Manhattan. And the reason why we presented on this topic is because many of you may remember that we've been doing many webinars since the pandemic has started. And we asked for what you wanted to hear more about. And one of the main topics that we heard a lot of requests for was caregiving for those who have a diagnosis of dementia in the home, where we may not have as much access to the many wonderful programs that are out there. And so how do we cope with that? How do we make the most and make sure that our loved ones are being engaged? If we are paid caregiver or a family caregiver, the stress is there, right? And it's a difficult challenge, and we want to do the best. And in my mind, as many of you have heard me say, caregivers are superheroes. What you're doing is wonderful work, and sometimes may not feel like it's as appreciated as it could be. But let me tell you, all the people that count on you, that believe in you, we're so very thankful. We're so thankful as a whole entire population and world, because without you, we wouldn't be here. So these are some tools for, again, family caregivers and professional caregivers, some of which we might say, oh, we know that, but some of them are great reminders. And there's also going to be some new tools, I believe, that people will be able to have and be able to utilize in giving their loved ones or their residents the best care. Okay, so without further ado, let me introduce Sunrise East 56, who will be taking over the content of this particular webinar. They have a lot of experience. Most of you know what Sunrise is: assisted living, providing wonderful service within their facilities. And East 56 is brand new, and it's very exciting, and it's a little different twist, I think, on the Sunrises. And so I'm gonna have them talk a little bit about that, and then on to all the tips we need for caregiving for our loved ones or patients who have dementia. So without further ado, Gina, do we want to take it over, and Ginny?
Sure. Well, thank you so much, Nicole. Thanks for giving us the opportunity to be here today and communicate with everyone that's on the call today. Thank you, Teresa, for also putting this together. And we're so excited today because we have an opportunity to share with you some of the tips and different techniques and strategies, some of the best of what we do inside of our community every day. We're going to be able to share with you, and we're going to be joined by our resident care director for Sunrise East 56, Maria Basora, who's a registered nurse, and she's been in healthcare and served the healthcare population over the past 30 years. And we're excited to talk to everybody. And then beside me, we have our general manager, Ginny.
Hello. I've been with Sunrise 18 years. I'm now the general manager here at East 56 with the wonderful team. Previously, I served as an executive director for the company in New York and Connecticut. So really exciting. Finally, that we're getting close. We're in the building now. And we're just preparing to open and start taking care of residents right here in East 56. So really excited.
Yep. We're physically in the building, like right now. What you see there is the building.
At this minute.
Yes, in the minute.
And the reason I look so small is because we are social distancing because we took off our masks. So that's why I'm very far away.
We're about 20 feet apart right now, but we look like but it's about 15 feet. So it's social distancing. But I know there's a lot of healthcare professionals on the call today. And if you guys ever happen to be in Midtown Manhattan, we're right on the corner of East 56 and Lexington. The physical building is not open to the public yet, but we can expect to welcome you in September. So if you're ever in the area this fall, we'd love to have you stop in for a tour. So without any further ado, I guess.
Let me just say one more thing. I always do this. I forget to introduce myself. So my name is Nicole Christensen. Sorry about that, because some folks probably don't know who I am. So I'm the CEO of Care Answered. We provide patient advocacy and care coordination throughout New York and other places as well. I'm also the author of the book From Crisis to Calm, a patient advocate's take on healthcare coordination for you, the common caregiver. And I'm just delighted to be able to offer this. What we do is we help people navigate the healthcare system to access their best care. And so much of that is put on caregivers. So we're there to expertly kind of lead you and navigate you through and answer your questions. So Care Answered was really created as a solution for those barriers to accessing care. And then the book on top of that was to reach people even more broadly. So that's who I am. Again, thank you so much for being here. And so I'll let you introduce Maria again.
Yeah, I mean, and I know we have about 10 communities throughout Long Island, and you know, Sunrise has been working with Nicole. I know probably for the past couple of years, you know, for our residents and prospective residents. So thank you, Nicole, for always delivering the best for our residents. So yeah, Maria Basora, our resident care director. I think I kind of gave a brief introduction, right? So Maria, I guess the floor is yours. You might just have to take yourself off mute, though.
Yep, that's true. That's the part we always forget. Thank you so much, Gina, and thank you so much, Nicole, for inviting us here today to do this presentation. As we know, taking care of residents with Alzheimer's and dementia can be very challenging, both to family members and at times to staff. But Sunrise has been an expert in this area for many years, and I'm very privileged and honored to be a part of it, and grateful to be here today with all of you. So to get started, you know, I'd like to say that many of you have most likely encountered or heard of someone with Alzheimer's disease exhibiting behaviors that we often call behavioral expressions that we call challenging, right? We call them challenging behaviors. But this training will give us the opportunity to discover more about unmet needs that can lead to different behaviors and provide some instructions for how we should respond in challenging situations. So our learning objectives, if we go to the next slide, will be at the completion of this training, participants will be able to realize that all behavior is communication. To obtain necessary core competencies to respond in challenging situations, to demonstrate at least 2 verbal and 2 nonverbal validation communication techniques, and that's a great technique that we'll be talking about more. Describe at least 2 basic human needs of residents with memory loss, and describe 1 harmful side effect of antipsychotic medications. Next slide. So behavior has become a very popular topic in the field of dementia care. But why is behavior such a popular topic, right? It's at least 75% of all persons with dementia will exhibit some form of behavioral expression or what we consider a challenge in behavior. The approach of the person caring for the person with dementia can affect that behavior. The person with dementia will respond based on the changes in the brain, the accumulated losses of aging, both sensory and physical, as well as their background and their previous ways of coping and responding to stressors. All of these responses are really their way of trying to tell us something. Their behavior is their way of communicating their need. We can't change the behavior of the resident, but we can change our approach. Next slide, please. So how do we ensure consistency in person-centered care? The Alzheimer's Association provides the following dementia care practice recommendations. First is consistency in individualized person-centered care. Know the person, their background, unique traits, their likes and dislikes, their needs and their abilities, and know and anticipate what might create stressful situations that could cause behavior or communication challenges. Next slide. As caregivers, our role is to try to best to connect to the behavior to the need. So when we see a behavior, there's a need behind that behavior. So it is very easy to label words and actions which are uncomfortable as behavior. So sometimes someone is doing something and we may call it a behavior. Instead, we must learn to see this as communication and try to identify the underlying or unmet need and help us to connect with residents when they are anxious, upset, or have trouble using words. Does not judge or try to change their reality. Something else we want to do. Next slide. Caregivers need to ask these questions in order to figure out what the basic human need is. And then we should always begin with assessing if there's an underlying or physical need behind each behavior. So for example, if you see screaming, shouting, moaning, rubbing of a body part, is there a physical need behind that? Could there be pain, injury, maybe an infection, a headache, a toothache, podiatry care, right? So we have to meet the physical needs behind that behavior. Does the person seem insecure, sad, missing someone, repeatedly asking to go home? So the underlying need there could be love and the need for security. The behavior you might see might say they feel useless. They're looking for things to do, rummaging constantly, searching, or appearing frustrated. They need purposeful work or something to do to feel purposeful. Do they cry often, act angry or upset with you or others, and repeat the same story over and over again? That may be a need to be listened to. Next slide, please. And there are certain times when a person with Alzheimer's disease are more likely to become upset. And these could be during bathing or showering, after meals, change of shift if you're in a facility, sundowning, sometimes in the evening when things are more quiet, you see those increased behaviors, continence care, getting dressed or undressed, feeling that they have a decreased personal space, noisy environments, encounter with another resident, grooming, dining, activities, and when a resident's bored, right? Because we want to give them purposeful things to do. Next slide. According to Carly Helen, dementia specialist, generally there is a reason for combative or aggressive behavior. The question is to ask why. Next slide, please. Now, sometimes difficult behaviors or communication can escalate to combative or aggressive behaviors. And there are many causes that, when compounded with dementia, can lead to an escalation of that behavior. And we're going to take a closer look at these stressors. Sometimes you have staff-related dementia, psychosocial-related dementia, physical-related stressors, environmental-related stressors, the cognitive stressors, and there's also non-dementia-related stressors and disabilities. So we'll take a look at these one at a time. Next slide, please. We'll start with the non-dementia related. So you want to look at some possible physical causes that, when compounded with dementia, can lead to an escalation of that behavior. So you always want to assess physical things first. Sometimes when we see a behavior, there's that there may be a physical reason underneath, right? So you want to see if there's an undiagnosed fracture, chronic pain. That's a big cause of behavior sometimes. Current pain, right? Do they have a toothache, headache, maybe something in their feet? Another physical cause could be an infection, hypoglycemia, seizures, anemia. So you want to do lab work and see what's going on from that physical standpoint. Dehydration, sometimes our residents don't get enough to drink. Fatigue due to an impaired sleep cycle. And then depression and psychosis. Next slide. Some of our cognitive related dementia stressors. It's a great rule here. Never watch anyone on TV who you wouldn't have to your house for dinner, right? Because sometimes that's sensory stimulation. So interpreting noise, TV, or others' conversations as theirs and getting involved with it. Decreased attention span or inability to remember. Difficulty making choices. Difficulty accepting changes to schedule or routine. Misinterpretation of objects, people, tasks, and environments. Sometimes tasks are too complicated. And difficulty understanding or being understood. Next slide, please. Now let's talk about some stressors or triggers in the environment that might cause a resident to react in a challenging way or in an aggressive manner. Unfamiliar surroundings, limiting wayfinding cues. Sometimes there's just too many things in the environment that can be a little confusing. Barriers, real or perceived, that limit or confine. Sensory overload, lights that cause glare or a reflection, loud sounds, constant or disliked noise, mirror reflections. Sensory underload and quiet, bland surroundings and poor lighting could also trigger those behaviors as well. Next slide, please. So we know that there are a number of physical conditions that can lead to a resident feeling stress and having difficult behaviors as well. Being startled and approached from the back. A lot of dementia residents don't want to walk up on them. And also I find that if you're leading a resident into the room, say like the bathroom, you want to go ahead of them and let them see that they can go in that space, because there's a diminished body and space awareness. Fatigue from disruption of sleep patterns, and harmful side effects from some medications. Those are also things to consider. Next slide. According to the Harvard Medical School study published in the British Medical Journal in 2012, US nursing home residents who took Haldol had double the risk of death as those who took most types of atypical antipsychotics. The risks were highest during the first 40 days of treatment. Antipsychotics cause increased incidence of death from strokes and cardiovascular incidents. Residents can appear dazed and less responsive state, not able to enjoy the day. And there's an increased risk of falls also associated with antipsychotic use. Next slide, please. The recent Harvard study, among others, shows that antipsychotic drugs given to elders with dementia generally do more harm than good and are a very dangerous substitute for actual care. An editorial titled, "Our Most Easily Abused," Mike Masterson describes a late 1980s investigation by the Arizona Republic that revealed how elderly nursing home residents were being over-medicated. And he wrote, "One drug of choice was Haldol, a powerful antipsychotic medication that left them continually stunned into head dropping, drooling submission. Misusing a Haldol pill was much cheaper than paying for adequate care staff. Just slip them a pill and forget about them." Have you ever noticed someone tired or listless throughout the day? Perhaps they have a dazed look and their head is slumped to the side. This could be a sign that they are an antipsychotic drug that should be reevaluated. And of course, we know that there's a treatment regimen that has to be followed, but it's important that we assess that and make sure that we're not overusing or, like I said, overusing the medication. So anytime you see that type of situation in the resident, that somnolent kind of look, you want to make sure that the doctor really evaluates the use of antipsychotics if they're present. Next slide, please. Fortunately, the Center for Medicare and Medicaid Services has announced that they would be taking initiatives to cut back the use of unnecessary antipsychotic drugs in nursing homes and find other alternatives to improve behavioral health problems. Patient-centered care, the concept of respecting and attending individualized needs, wants, and preferences of residents is at the heart of the CMS initiative. The key is to know your patient's strengths and allow them to participate in their care. This will go a long way to ease the patient's stress and behaviors, as well as cut back on the overuse of antipsychotic medications. And of course, family members and caregivers are a big part of that role, because as a team together, we know what impacts that resident's daily life. Next slide, please. Now, as we discussed in an earlier slide, there are many reasons for challenging behaviors. Here are some additional psychosocial related stressors. Lifelong personality patterns of aggressive or angry outbursts exhibited as stress-related responses. Becoming embarrassed when having questions asked that cannot be answered, leading to feeling put on the spot. Being teased or told no or don't. Hallucinations, paranoia, suspiciousness, depression, feeling lost, fearfulness, anxiety, frustration, and feelings of inadequacy. Unrealistic demands from others, not having preferences respected, and being treated in a childlike manner or with a condescending approach or tone of voice. So we always want to make sure that we preserve the dignity for our residents. Next slide, please. Now, have you ever witnessed or been an object of one of these types of stressors, right? How many caregivers does it take? So these are staff-related stressors that can happen. We have verbal and we have nonverbal. So on verbal, staff not speaking English or the common language spoken by the resident, using sarcasm or talking about residents in front of them or being bossy, or too many caregivers present and communicating. Sometimes staff members may have a tendency when treating a resident with dementia to talk to each other or to talk about other things in front of the resident, and that can be very frustrating. So that adds to that resident's stress level. Now, nonverbal, maybe caregivers that move, act, or use a voice tone that residents interpret as being angry, fearful, flippant, or non-respectful. Caregiver size, a large size person may appear to be frightening. On the other hand, a small size provider may arise fear of falling. And caregivers gender and or culture. Sometimes you have older female residents that don't want to have male caregivers. So you have to know that background. That's why it's so important to have that, right? It's very important that we always use empathy and think about how the person might be perceiving our actions. It might be difficult to not take these reactions personally, so be sure to reach out to your coordinator for support and guidance. Now in the next 2 slides, we had an exercise that we're going to be bypassing just because of the nature of our setting. So if we could skip down to 22, need-driven vocalization. The one prior. So another common behavior we see in individuals with Alzheimer's disease are need-driven vocalizations. They repeat the same sound, word, or action over and over again, and these types of behaviors can be stressful to others. We must try to find ways to understand their unmet need and respond to it with empathy. Common causes for need-driven vocalizations include being too hot, too cold, hungry, thirsty, tired, continence needs, physical discomfort or pain, unmet psychosocial needs such as loneliness, boredom, need for meaningful work, overstimulation, and environmental triggers. Sometimes these vocalizations may be more loud or aggressive in nature. In cases where the vocalizations become loud or aggressive, it is very important that we listen and respond to the resident's unmet need to try to prevent it from escalating further, because in some cases, when the resident is still in a stage where they can willfully act, this behavior can escalate into physically aggressive behavior. Now, why can this be a problem? Well, it often results in negative feedback from others, social isolation and stress. Research shows that these individuals frequently receive single-strategic care that's not effective, because sometimes we're doing the same thing over and over as well. Caregivers exposed to need-driven vocalizations often experience emotional tension, feelings of impotency and frustration, and distancing themselves from the resident, and burnout and stress. Next slide, please. Now we have multiple strategies that can be used to treat persons with behavioral expressions. First, treat pain. Recognize and remove the cause of pain and or administer pain relievers. And sometimes I've seen that a lot. Sometimes a resident, when they have that behavior, we've tried just putting them on Tylenol a couple of times a day, and you notice that those behaviors decrease. So that's how you really see if pain could be a factor, right? Manage physical needs. Try to understand and respond to basic physical needs for comfort. Approach with a caring attitude. Research shows that individuals thrive when caregivers try to understand their needs, provide for physical and psychological needs, show concern, and get to know them. Use validation techniques. Center, observe, ask open questions, rephrase, mirror, and say the emotion you observe with emotion. Use touch and use music. Sorry, phone is like. Provide sensory stimulation. Develop individualized sensory experiences based on the person's interests, passions, and past experiences. Use music. Music is a great tool. Music from childhood, from the country of origin, religious music, or songs that are well known and loved in the past can be used to engage the resident and perhaps encourage that resident to sing along with you. Presentation of a videotape of a family member talking to the person. Ask a family member or loved one to record a video or an audio message addressing the person by name and providing stimulation and comfort. Social interaction. People with need-driven vocalizations are at great risk for becoming increasingly isolated. Find ways for them to spend time with others. Next slide, please. Now, a validation technique was developed by Naomi Field, primarily for the very old population, and uses empathy to connect with individuals with dementia. She wrote, look at the whole human being, not just the condition of the brain, to understand the reason behind the behavior. Now we're going to take a closer look at two specific validation principles and the theory behind them. Next slide. So the first validation principle is listening with empathy, builds trust, reduces anxiety, and restores dignity. Let's review an example. So a woman angrily declares that the caregiver threw a basin of water over her clothes and now she's all wet. The trusted, familiar validation caregiver rephrases and asks, does that happen every morning? She says, yes, every morning. Is there a morning when she doesn't throw water over you? Well, only when the very nice young lady comes to look in on me in the night. She asks if I need to go to the toilet. You see, I'm getting older now and I have a problem sometimes with pee-pee. Next slide. So the action there, we understand that this woman is ashamed of being incontinent and emphasizes with the feelings of the older person without concentrating on the truth or the fact. The theory behind it from a humanistic, psychological, most especially Carl Rogers, who focused his client-centered approach on using empathy. Next slide, please. Our next validation principle is painful feelings that are expressed, acknowledged, and validated by a trusted listener will diminish. Painful feelings that are ignored or suppressed will gain in strength. So here's another example. An older woman gets up at 3:30 every afternoon to go home to her children. When the staff says, sit down, everything's okay, she gets more and more nervous and upset. When they ask, what is the worst thing that can happen to your children? The woman expresses her vivid memory of having left her children alone. Her fears are expressed to a validating caregiver, and the old woman feels relieved. Next slide. So that action, we are open to all feelings that are expressed by older people. Through empathy, we share these feelings and encourage expression. We acknowledge that disoriented older people freely express emotions in order to heal themselves. And the theories from a psychoanalytical psychologic Freud, the cat ignored became a tiger. You know, these are very important validation techniques. I'm sure some of you remember there was a time where we used to say, leave the person sort of reality orientation. But validation techniques are very important because it really does bring soothing comfort when a person is experiencing these stressors. Next slide, please. So when you have a validation technique in this situation, when a resident says, where is my mother? Ask yourself about her basic human need and how you would respond. Often when a resident is time confused and asking for her mother, she has a basic human need for love and security. Spend time talking with her and asking her some open questions such as, tell me about your mother, or I see you really miss your mother. It's so hard when those we love can't be here with us when we need them. You use soft touch on her arm or her hand. If trained in validation, you can use a mother's touch or soft stroking on both cheeks and reassure her, reminiscing with her about her mother. One of the most important things we can offer as caregivers is to make genuine eye contact, to listen with empathy, and to give our full attention to the resident. It's also very important that we finish talking and we try to redirect her to another resident who she can spend time with, or to an activity that gives her meaning and purpose. Next slide, please. There are many validation techniques. The most basic of these include centering. This is something you want to do before approaching the resident and using validation techniques. And we'll practice this one in a minute. Using genuine eye contact. Just like the previous example, when the woman asks, "Where is my mother?" you can see in the photo that the caregiver used genuine eye contact. This is an important first step in making a good connection and conveying that you care. Using a warm voice tone. We know how we feel when someone speaks to us in a warm, kind manner versus a harsh tone. It makes all the difference. Never raise your voice or shout. Lower your tone and speak more slowly and in a calm, warm manner. And of course, using music. Know the resident's favorite type of music, their favorite song. How does hearing your favorite song make you feel? Do you have a personal story about a positive outcome when using music? So in order to get a better understanding of validation, we're going to refer to the resources. You can refer to the resources at the end if you need any further information. Now, centering is something that we're going to look at because it's something we can do. Next slide, please. Centering exercise. Now let's center. If you focus on a spot about 2 inches below your own waist, inhale deeply through your nose, filling your body with air, and exhale through your mouth. Stop all your inner dialogue and devote all your attention to your breathing. You repeat this procedure slowly 8 times. Centering is the key. You can't validate if you don't center first, because as caregivers, we want to have that warm, calm center so that we can approach the resident and help them de-escalate their behavior and help them with their needs. The next 2 exercises we're going to skip, if you could skip 34 and 35. So additional communication approach tips. As we all know, it's very important to know what steps to take during a challenging situation in order to manage it appropriately. So our first tips are sit or stand at eye level or below unless the resident is very angry or aggressive. Then you stand at the side and approach in a less direct manner. Show respect at all times. Match the resident's gait if he or she is pacing. Enter the resident's emotional world. Observe and match their emotion. Speak clearly and slowly. Match their voice tone and tempo. Do not attempt to touch them if they appear agitated. Remember the 5-foot rule, stay at least 5 feet away if they appear to be aggressive. It is essential to gain their trust. Do not argue or try to reason, and ask only one question at a time, giving them plenty of time to process. So those are some of the things we wanted to share with you today. We'd open it up to any questions at this time.
All right, I'm checking the chat. I don't see any questions yet, but I want to say in my work as a patient advocate, these are such helpful tools to families and paid caregivers alike, because I think people get caught up. It can be frustrating, right? And I think the whole centering and often I see with the pain that you mentioned, Maria, you know, just some Tylenol can make a huge difference in those challenging behaviors, because they can't articulate potentially that they're in pain, and it doesn't come necessarily to a loved one's mind immediately that might be the cause. So I thought that was super helpful. And then just empathy, and I love that we used music a lot, because those who know me, I speak a lot about that. I've seen how effective it can be for every person, right? But especially when somebody has a diagnosis of dementia. I think that's a really wonderful way. I remember even as being a young person, I would bring music into nursing homes, and it was a completely different atmosphere once music is involved. Somebody does have a question. Oh, Sharon said, can we get a copy of this presentation? Yes, it will be available on the website as far as this video. We'll have to talk to Sunrise about the presentation by itself. You can let us know. And the other is, a little bit more about the issue of understanding one's body in space. I'm gonna take a little bit from that, but then Maria, I'm gonna have you talk about it more from your perspective. So one of the things that was mentioned within these slides is something that we hear a lot when somebody is coming up too close to a person that has a diagnosis of dementia, or the whole showering, right? That's generally a difficult thing. And it seems in many of my clients that there's a fear involved, right? With the coming close first, and showers, absolutely. So and the shadowing, right? As much light, when you talk about sundowning, that's an expression is used, but also when there's shadows and light kind of refracting, when somebody has episodes of hallucinations, that can make it all the worse because they're seeing things in a much more challenging way than you and I might see them. But Maria, will you tell us a little bit more about one's body in space?
Sure, and there's, I mean, in residents with Alzheimer's and dementia, you see a lot that the brain picks up the amount of space there is sort of differently, and the perception of that time. Like I remember 30 years ago when I started in nursing, in the first Alzheimer's units I used to work in, one of the techniques they used to do to try to prevent elopement was they would put very black mats in front of the exit, because to a resident they would perceive that as a hole in the floor and they wouldn't step in it. So you have to be really mindful of that fact that as that dementia advances, that spatial perception changes quite a bit. So even going into the bathroom, they may not perceive that they fit in that space. So a lot of people, I remember the Alzheimer's Association recommended a long time ago, when you want to guide, even at home, your loved one into the bathroom, sometimes we like to stand behind them because we're afraid that they'll fall, but we're putting them in front of us and we're guiding them in, but they're afraid because they don't think they can fit in there. So if they say you go in first and they can see that you fit in that space, they'll be more likely to walk through that door. So those are the kind of perceptions that, you want to get to know what your family member, your loved one, your resident is doing. Observe that. And if that looks like that perception is starting to go, because as they progress, that is going to change, you can use those techniques, walking ahead of them, hand holding, showing that you can do something and they'll follow it. And music, like you said, I think music is a great thing, and Sunrise is really great at using music as well, but playing the music that they love, because sometimes caregivers I've seen in the past, they'll play the music that's current, but that may not bring back that memory and that soothing time. So even during bath time, if you have a family member or a loved one that's resisting that bath, make it an enjoyable time. Put the music on, bring things that you can reminisce, hand them that towel, let them do the parts that they can do for themselves while you're doing the parts that they cannot do, and engage them. And sometimes that's a really big help.
Yeah, thank you for sharing that. I think the engagement in general, right, is one of the things that you were talking about as far as doing something that engages them, that's worthwhile to them. I think music is a really great way to do that. You can get people singing that I have seen, and I've utilized this, putting on music that is from their history, right? That brings back happy memories for them, and or religious music, as you said, that they'll start singing, like somebody that wasn't verbal will start singing or humming with the music. And it's such a glorious thing because it's such a connection, and it's very lovely. But I think all of those things also I've seen when people had a profession that they really enjoyed or did for a really long time, to somehow bring that into their lives in whatever way possible. I know I had a client that she would pull apart things. She was a homemaker, but she would pull apart things. So every time I was going to see them, not being the caregiver, but working with other things, I would bring papers for her to organize. So when we would talk, so she would be more calm. And it had such a great effect because she was doing something and she knew that it was being valuable, right? And so I would bring papers and she would collect them and put them. And I know that many different places and caregivers utilize all different kinds of things to engage their loved ones or their residents to again increase that quality of life. And the arts in general are just such a helpful way to bring that about, I think.
Yeah, here at Sunrise, we have life skill stations, which are wonderful. The residents have an office set up, a nursery, things that they can connect with. So there is that purposeful, meaningful activity that they can do, that they connect with, like you said, and it's great to watch.
It is. Let's see. Thank you, Sharon. She said your presentation was wonderful. Are there any other questions? You can take yourself off mute if you'd like, if you want to ask rather than type. Let me just try to make this bigger. All right. So with that, then I think we'll leave you with that. But I just want to thank Sunrise for participating in this, I think, very important webinar. I hope everyone was able to leave with some tip information that will help them be even a better caregiver than they already are. And just, again, tools. And we're always here at Care Answered, here to answer any questions. If you're going through something, we can either put you in touch or help you out ourselves to get that information that you need to be the best caregiver you can be. All right. So thank you all for being here, and stay safe and healthy. And I look forward to seeing you virtually and maybe in real life sometime soon. All right. Take care.
Thank you.
Thank you.
Thank you.